Hello everyone, good morning, good afternoon, and good evening. We are from small group discussion B10, and now we want to present our student project assessment that the title is Vasculitis. Student member ID list. There are 13 members inside it, and let me introduce myself. My name is Putai Temeswari with 3-digit number is 202. So this is the table of content of our student project. The first one is introduction, and then content, and conclusion, and the last one is reference. So let me start from introduction. So the background of the vasculitis, the vasculitis is an inflammation that occurs in blood vessel resulting in tissue damage with or without the causing the organ damage. And the vasculitis itself causing change in the walls of blood vessel. It can occur as the form of thickening and narrowing, blockage, tightening, and stretching of the blood vessel. Vasculitis itself can be divided into three types, namely large vessel vasculitis, medium vessel vasculitis, and the small vessel vasculitis, and may be idiopathic or associated with underlying pathology or disease. And this is the problem formulation. So the first one is, what is vasculitis? How is the epidemiology of vasculitis? What the cause and risk factor of vasculitis? What is the pathogenesis of vasculitis? How to diagnose the vasculitis? And how to manage the vasculitis. Next one.
This is Putri Dewi Rahadi, and I would like to present about the objectives and the benefits of making the student project. 1.3 Objectives. The objectives of making the student projects are: first, to determine the general information of vasculitis; second, to discover the epidemiology of vasculitis; third, to discover the etiology and risk factor of vasculitis; fourth, to know the pathogenesis of vasculitis; fifth, to find out how to diagnose vasculitis; and sixth, to know how to manage and treat the vasculitis. Next, 1.4 Benefits. The benefits of writing the student project is to increase the knowledge and insight of readers and also writers related to vasculitis. In addition, this paper was made in order to be able to increase public awareness, level of knowledge about vasculitis, from the definition, epidemiology, etiology, risk factor, characteristics, and management.
Hello, my name is Freddy Jonathan with my 3 last name digit number is 164. Today I'm going to continue the presentation about the definition. Vasculitis is an inflammation of the blood vessel wall. The vasculitis are a diverse group of disease characterized by an inflammatory response in the vascular wall and perivascular tissues. It is classified as a complex syndrome in terms of etiology because several types of vasculitis can be elicited by different stimuli, though the majority of them are classified as idiopathic. Its severity can range from a self-limited disorder in a single organ to a life-threatening disease caused by multiple organ dysfunction. The systemic vasculitis classification divided by two. The first one is the primary vasculitis syndrome and the secondary vasculitis syndrome. Thank you.
Hello, my name is Anagung Ramujit Kanaparawangsa with student ID number 20025111193. I will explain about the epidemiology. Vasculitis is a condition of unknown etiology. The incidence and the prevalence is still quite a bit known, but there is increasing data, especially in Europe. Because there are still gaps in our knowledge about the occurrence of vasculitis, it makes the epidemiology of vasculitis continues to be well studied. This condition is associated with the extreme of age in Asian children under 5 years, with Kawasaki disease being the common in the Asian population, with incident 90 per 100,000 incident per year. The primary systemic vasculitis is common, happen in the patient age 95 until 74 years old, with a peak incident of 9 per 100,000. Next.
Good morning, afternoon, or evening. My name is Alexander Putri Windarto. With my 3 last digit is 112, and today I'll be explaining about the etiology of vasculitis. So actually, the etiology of vasculitis remains uncertain. However, there are various risk factors that can be linked, such as drug reactions, infections, inflammations, and neoplastic factors towards the causes of vasculitis. So first, for drug-induced vasculitis is mostly frequently associated with antibiotics, mainly bactalactams and quinolones. However, other drugs such as non-steroidal inflammatory drugs or paracetamol may also cause vasculitis. Second, for also genetic factors, there has been studies that shows that human leukocyte antigen or HLA region plays a significant role towards the causes of vasculitis. Next are various infections, which ranges from bacterial, fungal, protozoal, mycobacterium, or specific infections that may also cause vasculitis. Lastly, inflammations that are usually caused by autoimmune connective tissue diseases such as AICTD and other diseases may also result in vasculitis.
My name is Igustin Mudah Alista Sadia Diksa with 3 digits of my name is 145. Today, I will tell you about the pathogenesis of vasculitis. As we know, the endothelium is a functioning player in incendiary cycles and pathogenesis of vasculitis. Cytokine interceded change in the articulation and capacity of attachment particles combined with improper initiation of leukocytes and endothelial cells are the essential component impacting the degree and area of vessel harm in the vasculitis condition.
Hello everyone, my name is Trisanggal Arjo with the student number of 20025111230. Now I'm going to explain about the clinical manifestation. There are several symptoms that appear in patients with vasculitis. The symptoms can be divided into general symptoms and symptoms involving organs or organ systems. General symptoms that appear in patients with vasculitis include fever, headache, fatigue, weight loss, general aches and pains. Other symptoms involving organ or system or organ systems include the first one is digestive system. If the digestive tract is disturbed, people with vasculitis can experience pain after eating. And the next one is ears. Ringing in the ears can suddenly occur. And the next one is eyes. Patients with vasculitis may experience red and itchy eyes. Giant cell arteritis can cause temporary, even permanent blindness. The next one is hands or feet. Numbness and weakness in the feet and hands, followed by swollen and hardened feet and hands, tend to be experienced as well. The next one is lungs. Vasculitis can affect the lungs, namely by the occurrence of shortness of breath to coughing output. And the last one is skin. Red spots, lumps, and open sores on the skin also occur due to bleeding.
Hello, my name is Angelda Ephraim Horas with 3 last digit number is 055. So the next one we're gonna talk about the diagnosis. Early diagnosis of vasculitis is very crucial for starting therapy and reducing the risk of vascular complication. There are several diagnostic approaches the clinical practitioner can take to ensure the accurate diagnosis of vasculitis, starting with taking the patient's medical history, physical examination, and doing diagnostic tests in order to exclude the other differential diagnoses to get the exact diagnosis. There are several types of diagnostic tests. There are blood tests, imaging tests, and biopsy.
Hello, my name is Putri Orina Setiawan with last registered student ID number 097. So now I will continue the diagnosis of vasculitis. There are several diagnostic tests for vasculitis. First is blood test. So blood test is performed in order to detect specific markers of inflammation such as high level of CRP. And blood tests can also detect certain antibodies to aid the diagnosis and classification of specific vasculitis. Next is imaging test. This imaging test may help to detect in which area of the organs and blood vessels are affected. And imaging tests also can monitor whether the body is accepting the treatment or not. These imaging tests include the different imaging modalities such as X-rays, especially angiography, CT scan, PET, ultrasound, and MRI. So the angiography is used as a gold standard in diagnosing the vasculitis. And beside the angiography procedure, CT scan is more effective to evaluate the abnormalities because it can visualize of internal complication in any organ systems. And next, in diagnosing the LVV or large vessel vasculitis, we can use the PET or CT scan. PET itself can help to diagnose the LVV, particularly like Takayasu arthritis and giant cell arthritis by detecting hypermetabolism with the vessel. And in diagnosis of vasculitis, study shows that MRI offers detail regarding the image of the vascular, while FDG or PET CT scan offers detail regarding the progression of the disease. And MRI itself is preferred in evaluating injured soft tissue. Next.
My name is Tias Irawan and my student ID number is 2002-511-082. And I would like to continue the presentation about how to diagnose vasculitis, particularly speaking of the examination that is performed to help the diagnosis. And we are going to look further about biopsy. Biopsy is performed by taking a sample of tissue from the affected area. Then it will be examined. Since only a few vasculitis syndrome have pathognomic clinical, radiographic, and also laboratory findings, diagnosis of vasculitis requires skin biopsy to Histological confirmation. Skin biopsy itself is considered as the gold standard in diagnosing cutaneous vasculitis. It is also able to exclude the other differential diagnosis from vasculitis mimics. However, due to its expensive procedure and its associated risk of complication, biopsy in this context, arterial biopsy, is not that frequently performed. Thank you.
Greetings everyone, I'm Janice. Now I'm going to continue about the risk factors of vasculitis. The first one is age. Vasculitis mostly happens at any age, but some kinds of vasculitis are more common to happen in certain ages of people, such as Buerger disease that affects men that is younger than 45 years old with smoking history, while Kawasaki disease mostly happens in children with under 5 years old. The second one is lifestyle. Bad lifestyle or habit, such as smoking habit or consuming illegal drug history, such as cocaine, might increase the risk of vasculitis in patients. The third one is genetics. Genetics are playing some roles in vasculitis that might affect the occurrence of vasculitis. For instance, Behçet disease is connected with the genes in the immune system and sometimes might transfer among the family. The next one is ethnicity. Some types of vasculitis are more commonly happen in some area with specific ethnicity, such as Kawasaki disease is most common in Japanese children. The fifth one is sex. Sex also plays some roles in determining the incidence of vasculitis. Some examples of it are Buerger disease that is more common to happen in men rather than women, while giant cell arteritis 2 times more often happens in women than men. The next one is medicines. Consuming certain medicines such as hydralazine and levamisole might bring higher risk of vasculitis incidence in patients. The last one is other medical condition. Some medical state or conditions of patients, such as patients with autoimmune disease, lymphoma, or patients that are currently experiencing hepatitis B or C, this kind of medical state will affect the incidence of vasculitis in patients. These are the risk factors of vasculitis. Next will be continued by my colleague. Thank you.
Okay, now I will continue the presentation. My name is Mark. I will illustrate the mining R120. The management. Usage of immunosuppressant is important and it must be used as soon as possible to reduce the inflammation. This is because the progression of the vasculitis can cause irreversible organ failure. In most cases of vasculitis, corticosteroid is often chosen as the first-line medication. Here's the method of vasculitis treatment based on which vessel it happens. Treatment of large vessel vasculitis. Most patients of this type are treated with corticosteroid drug. Because of the strong anti-inflammatory effect that happened during the early stage of the disease, patients are able to administer it with steroid. In some cases, vasculitis is resistant to corticosteroid, and because of that, physician is starting to make a new method of treatment using immunosuppressant to control the case of steroid-resistant vasculitis. The treatment of medium vessel vasculitis. Polyarteritis nodosa is the most common disease of this type of vasculitis. Therapy with corticosteroid has a good response to the patient with this condition. For the patient that suffer organ failure, combination therapy with immunosuppressive agent are needed. The treatment of small vessel vasculitis. Most cases of this type of vasculitis are anti-neutrophil cytoplasmic antibody-associated vasculitis, like microscopic polyangiitis with necrotizing angiitis of small vessel. Based on the GMAAV protocol, AAV is separated into 3 categories based on its severity: mild, severe, and most severe. Because of that category, there are 3 different protocols that are used for remission induction therapy using immunosuppressive agent. For combination therapy, the main drugs that are used are corticosteroid and cyclophosphamide. That's from me. Now, the presentation will continue with my friend. Thank you.
Hello, my name is Felicia with 3 last digit of name 166. I will explain the conclusion of our student project. Next. So, according to previous explanation, we can conclude that the term vasculitis refers to an inflammation of the blood vessel wall ranging from self-limited disorder in a single organ to a life-threatening disease caused by multiple organ dysfunction. The epidemiology of vasculitis still continues to be well studied, but it has association with some other diseases like Kawasaki disease, Henoch-Schönlein purpura, primary systemic vasculitis, and giant cell arteritis. The exact etiology for vasculitis still remains uncertain, but it is linked to some various risk factors such as drug reactions, infections, inflammations, and neoplastic factors. Besides that, the patient's age, lifestyle, and genetics also affect the risk of getting vasculitis. Pathogenesis of vasculitis starts with changes mediated by cytokine in the articulation and capacity of attachment particles, combined with improper initiation of leukocytes and endothelial cells. Some common general symptoms are fever, headache, fatigue, weight loss, general aches, and pains. Immunosuppression is necessary in management of vasculitis patients with the purpose to reduce the inflammation. Corticosteroid is often selected as the first-line medication. For the treatment, there are actually 3 types of treatment, which are treatment of large vessel vasculitis, treatment of medium vessel vasculitis, and treatment of small vessel vasculitis. So that is the conclusion of our student project. Next. And these are the references that we used in making the student project. Next. So that's all from B10 student project video about vasculitis. We really hope that this video is helpful for understanding vasculitis. Thank you, and don't forget to stay safe.